Hey everyone, it's Dr. Mike, and let's talk about something super important in healthcare today: patient satisfaction. You see, it's more than just a fancy metric hospitals use. It's about how you, the patient, experience care. Now, hospitals track something called Patient Satisfaction Key Performance Indicators, or KPIs for short. Trust me, these KPIs are crucial. They help hospitals understand what they're doing well and where they can improve to make your experience better. Ultimately, when hospitals prioritize your satisfaction, it leads to better health outcomes for everyone. And that's what we all want, right? So, let's break down the key KPIs and see how they impact your healthcare journey. The first KPI we're diving into is the Net Promoter Score, or NPS. It's a simple question with a powerful impact. On a scale of 0 to 10, how likely are you to recommend this hospital to your friends and family? Think about that for a second. Would you recommend a hospital where you had a bad experience? Probably not. A high NPS score means patients are happy with their care, they trust the hospital, and they're likely to tell others about their positive experience. That's word-of-mouth marketing, and it's incredibly valuable. Hospitals use your NPS feedback to pinpoint areas for improvement. Maybe the registration process was confusing or the wait times were too long. By addressing these issues, hospitals can boost satisfaction and create a better experience for everyone. Let's be real, nobody enjoys waiting, especially when it comes to our health. That's where the average wait time KPI comes in. It measures how long patients wait for appointments, test results, and treatments. Long wait times can lead to frustration, anxiety, and even worse, delayed care. Imagine waiting hours in pain just to see a doctor for a few minutes. Not a good look, right? Hospitals are aware of this, and they use wait time data to optimize their operations. By streamlining processes, improving scheduling, and even using technology like online check-ins, they can drastically reduce wait times and improve your overall experience. Remember, your time is precious, and hospitals are working hard to respect that. You know how I always say communication is key in any relationship? Well, it's especially crucial in healthcare. The Communication Effectiveness KPI assesses how well doctors, nurses, and staff communicate with patients. This includes everything from explaining diagnoses and treatment options in a way that's easy to understand, to actively listening to your concerns and answering your questions thoroughly. Effective communication builds trust and ensures you're informed every step of the way. Hospitals encourage their staff to practice empathy, use clear language, and prioritize open dialogue. Remember, you have the right to ask questions and fully understand your health. Don't be afraid to speak up. Let's face it, nobody wants to walk into a hospital that feels more like a horror movie set. Cleanliness and safety are non-negotiables. The Cleanliness and Safety Perception KPI measures how patients perceive the hygiene and overall environment of the hospital. A clean and safe environment reduces the risk of infections, makes you feel more comfortable, and honestly, it just makes sense. Hospitals are investing in rigorous cleaning protocols, hand hygiene stations, and safety measures to create a space where you can focus on healing. From sparkling floors to well-maintained equipment, every detail matters. So, the next time you're at a hospital, take a moment to appreciate the effort that goes into creating a clean and safe environment for everyone. So, you're heading home from the hospital. Great, but what happens next? The post-discharge follow-up KPI ensures that patients receive the support they need after leaving the hospital. This could include phone calls to check on your progress, scheduling follow-up appointments, or even connecting you with resources in your community. It's all about making sure you're not alone on your health journey. Hospitals are implementing comprehensive discharge planning programs that provide you with clear instructions, medication reminders, and access to support systems. Because let's be honest, navigating the healthcare system can be overwhelming, and a little support goes a long way. At the end of the day, patient satisfaction KPIs are more than just numbers. They represent a commitment to providing you with the best possible care. By focusing on these KPIs, hospitals are creating a patient-centered environment where your voice is heard, your health is prioritized, and your satisfaction matters. Remember, you deserve to feel comfortable, informed, and empowered throughout your healthcare journey. So the next time you interact with the healthcare system, don't hesitate to share your feedback. It's valuable and can help shape the future of healthcare for everyone. Stay happy, stay healthy, and keep those questions coming. This is Dr. Mike, signing out.